The Anatomy of Anorexia, Exploring the Causes and Consequences, written by Anna Bridges, narrated by Janice Peckers. Introduction, Understanding Anorexia, a brief overview. Anorexia nervosa is a complex and often misunderstood eating disorder characterized by an intense fear of gaining weight and a distorted body image, leading individuals to severely restrict their food intake. This condition not only impacts a person's physical health, but also has profound psychological and emotional consequences. Over time, anorexia can lead to severe malnutrition, organ damage, and in extreme cases, death. Despite its serious nature, the disorder is frequently overlooked or misinterpreted, with individuals suffering in silence due to stigma and a lack of awareness. The importance of discussing eating disorders. Eating disorders like anorexia are not simply about food. They are deeply tied to the mind, often representing a way of coping with emotional pain, stress, or a desire for control in an otherwise chaotic world. Anorexia, in particular, is often rooted in a complex interplay of biological, psychological, and environmental factors. Understanding the anatomy of anorexia, its causes, consequences, and treatment options is crucial for providing effective care and support for those affected. While anorexia may appear on the surface to be a pursuit of perfection or vanity, it is, in fact, a manifestation of deeper struggles with self-worth, identity, and emotional regulation. It is essential to acknowledge the pervasive cultural pressures that exacerbate this disorder, such as the media's portrayal of the ideal body and societal expectations placed on individuals, particularly women, to conform to unrealistic standards of beauty. These pressures, combined with individual vulnerabilities, can create a perfect storm, pushing someone toward the extreme behaviors associated with anorexia. Unfortunately, due to a lack of understanding, many individuals who struggle with anorexia do not seek help until the condition has reached a severe and often irreversible stage. This book aims to provide a comprehensive exploration of anorexia nervosa, breaking down the disorder into its core components. By delving into the biological, psychological, and environmental factors that contribute to the development of anorexia, we hope to shed light on the complexities of this condition. Through understanding, we can move toward greater empathy, support, and ultimately healing for those affected. It is not enough to simply recognize the symptoms of anorexia. We must also understand the underlying causes that drive these behaviors. Only then can we begin to address the disorder in a holistic, effective manner. By increasing awareness, reducing stigma, and providing accurate information, we can create an environment where those suffering from anorexia feel empowered to seek help and embark on the road to recovery. Chapter 1, Defining Anorexia. What is anorexia? Anorexia nervosa, often simply referred to as anorexia, is a serious eating disorder characterized by an intense fear of gaining weight, a distorted body image, and an overwhelming preoccupation with food, dieting, and body size. Individuals with anorexia engage in extreme measures to control their weight, often restricting food intake to dangerously low levels. Despite being underweight, they may perceive themselves as overweight or see their body as unacceptable, leading to an ongoing cycle of restriction and denial. The condition is not merely about food or appearance. It is a complex mental health disorder with deep emotional and psychological underpinnings. For those affected, anorexia becomes a way to cope with feelings of inadequacy, anxiety, or a desire for control in their lives. The behavior associated with anorexia goes beyond mere dieting. It is a life-threatening condition that requires specialized care and attention. Symptoms and diagnostic criteria. Anorexia is defined by a set of specific behaviors and attitudes, which can vary in severity from person to person. Common symptoms include extreme weight loss, an intense fear of gaining weight, and a distorted self-image. People with anorexia often go to great lengths to avoid food, engage in excessive exercise, or use other methods such as purging or fasting to control their weight. There is also a pervasive preoccupation with food, dieting, and body shape that can consume much of their time and mental energy. The diagnostic criteria for anorexia, as outlined by the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, include a significantly low body weight, typically defined as 85% or less of the expected weight for age, gender, and height, an intense fear of gaining weight, and a distorted body image. Individuals with anorexia may deny the seriousness of their low weight and continue to restrict their eating, even in the face of physical harm. In addition to the physical signs, psychological aspects such as perfectionism, a need for control, and emotional distress are often present. The spectrum of eating disorders. While anorexia is one of the most well-known eating disorders, it exists within a broader spectrum of related conditions. Bulimia nervosa, for example, involves episodes of overeating followed by compensatory behaviors such as vomiting or excessive exercise, whereas binge eating disorder is characterized by repeated episodes of consuming large quantities of food without purging. Though different in behaviors, all eating disorders share underlying psychological struggles related to body image, self-esteem, and control. Understanding anorexia in the context of the wider eating disorder spectrum is crucial for recognizing the disorder's multifaceted nature and developing appropriate treatment approaches. Anorexia is not simply a phase or a matter of willpower. It is a chronic, often relapsing disorder that requires comprehensive treatment to overcome. By defining anorexia clearly, we can begin to understand its complexities and the impact it has on those who live with it. Chapter 2: Biological Foundations. Anorexia nervosa is a complex disorder with deep biological underpinnings that play a significant role in its development and progression. Understanding the biological factors involved is essential to recognizing how the disorder affects both the brain and the body. While environmental and psychological factors are often at the forefront of discussions about anorexia, the biological contributions should not be overlooked, as they help explain why some individuals may be more vulnerable to developing the disorder than others. Genetic factors and heredity research has shown that anorexia has a genetic component, with individuals who have a family history of eating disorders or other mental health conditions being at a higher risk. Studies involving twins suggest a heritable predisposition, with identical twins being more likely to both develop anorexia compared to fraternal twins. Genetic variations influencing mood regulation, stress responses, and brain development can contribute to the onset of anorexia. However, it is important to recognize that genetics alone cannot explain the disorder. Rather, it interacts with environmental and psychological factors, such as familial dynamics or societal pressures, to create a predisposition for anorexia. Neurobiology of anorexia. The brain plays a central role in the development and maintenance of anorexia. Neuroimaging studies have shown that individuals with anorexia exhibit distinct patterns of brain activity, particularly in areas related to reward processing, self-regulation, and body image perception. Abnormalities in these brain regions may influence the distorted body image and obsession with weight control that are characteristic of the disorder. For instance, the insular cortex, which is involved in the awareness of internal body states, shows altered activity in people with anorexia, potentially contributing to the inability to recognize hunger cues or the perception of being overweight despite being underweight. In addition to brain structure, neurotransmitter imbalances also play a critical role. Serotonin, a neurotransmitter involved in mood regulation and appetite control, is often found in lower levels in individuals with anorexia. This deficiency can lead to feelings of anxiety, depression, and irritability, which individuals may attempt to alleviate through restrictive eating behaviors. Dopamine, which is associated with the brain's reward system, may also function differently in people with anorexia, possibly contributing to the reinforcement of behaviors that promote weight loss and self-control. Hormonal and metabolic changes. Anorexia not only alters brain function, but also impacts the body's hormonal and metabolic systems. When food intake is severely restricted, the body enters a state of starvation, and various hormonal changes occur to preserve energy. Levels of leptin, a hormone that regulates hunger and fat storage, drop significantly, leading to a reduction in appetite and metabolic rate. At the same time, levels of cortisol, the stress hormone, increase, which can further exacerbate feelings of anxiety and distress. Over time, the body's metabolic processes slow down to conserve energy, leading to a cascade of physical complications, including bone density loss, cardiovascular problems, and gastrointestinal issues. The biological foundations of anorexia are multifaceted, involving genetic predisposition, neurobiological factors, and hormonal changes. These components work together to create a complex disorder that cannot be understood solely through behavioral or psychological perspectives. By addressing the biological aspects of anorexia, we can develop a more comprehensive understanding of the disorder, paving the way for more effective treatments that consider all dimensions of the condition. Chapter 3: Psychological Factors. While biological and environmental factors play critical roles in the development of anorexia nervosa, psychological factors are perhaps the most influential in driving the behaviors and thought patterns associated with the disorder. Anorexia is often deeply rooted in emotional and psychological struggles that manifest as extreme weight control behaviors. These factors can contribute to the persistence of the disorder, complicating recovery and treatment. Understanding the psychological underpinnings of anorexia is essential for addressing the mental health aspects of the condition, which are just as significant as its physical manifestations. The role of mental health disorders. Anorexia nervosa often co-occurs with other mental health conditions, including depression, anxiety disorders, obsessive-compulsive disorder, OCD, and personality disorders. These comorbid conditions can both contribute to and be exacerbated by anorexia, creating a complex interplay of symptoms. For example, individuals with anorexia often experience significant anxiety, particularly about their body image, food intake, and weight gain. This anxiety can become all-consuming, leading to restrictive eating and excessive control over food. Depression is also common, as the individual may feel hopeless, worthless, or overwhelmed by their perceived lack of control in other areas of their life. The drive for perfectionism, often associated with both anorexia and OCD, can fuel the obsessive behaviors related to food, weight, and body image. Cognitive distortions and self-perception. One of the core psychological features of anorexia is the distortion of self-perception, particularly when it comes to body image. People with anorexia often see themselves as overweight, even when they are underweight, and they become preoccupied with flaws that others may not even notice. This cognitive distortion, known as body dysmorphia, is a key driver of the disorder. These individuals may engage in excessive mirror checking or avoid mirrors altogether, constantly scrutinizing their bodies. The perfectionistic tendencies that accompany anorexia often lead individuals to set unrealistically high standards for themselves, especially regarding their appearance. This drive for physical perfection is rooted in deeper psychological issues related to self-esteem, control, and identity. Trauma, stress, and coping mechanisms. Psychological trauma and stress are also significant contributing factors to anorexia. For some individuals, the onset of anorexia may coincide with traumatic life events, such as abuse, loss, or major life transitions. In these cases, restrictive eating can become a coping mechanism, a way to regain control over a life that feels chaotic or out of their control. The act of controlling food intake or body size provides a temporary sense of relief, though it ultimately perpetuates the cycle of the disorder. Additionally, Stress from academic pressure, family dynamics, or social expectations can create emotional turmoil, with anorexia serving as an attempt to manage overwhelming feelings. In these cases, anorexia may become an attempt to avoid dealing with deeper emotional pain. The psychological factors contributing to anorexia are deeply intertwined with an individual's sense of self-worth, identity, and emotional regulation. These mental and emotional struggles make anorexia a complex disorder that cannot be treated by addressing only the physical symptoms. Effective treatment requires an understanding of these psychological dynamics and a therapeutic approach that works to resolve the underlying emotional issues while also addressing the behaviors and thought patterns that fuel the disorder. Chapter 4: Environmental Influences. Anorexia nervosa does not develop in a vacuum. It is shaped and influenced by a variety of environmental factors that can either contribute to or exacerbate the disorder. While genetics and psychological factors play significant roles in its onset, the environment in which an individual lives, comprising family dynamics, peer relationships, and broader societal pressures, can have a profound impact. Understanding these environmental influences is critical for developing a comprehensive approach to prevention and treatment, as they can either act as risk factors or protective factors in the development of anorexia. Media, body image, and social pressure. One of the most significant environmental influences on anorexia is the portrayal of beauty standards in the media. The constant bombardment of images that glorify thinness and equate beauty with a specific body type can contribute to unrealistic ideals of how one should look. The fashion industry, movies, social media platforms, and advertising often present images of women and men who are unnaturally thin, creating pressure for individuals to meet these standards. For those already vulnerable to body image issues or perfectionism, this constant reinforcement of an ideal body type can increase the risk of developing anorexia. Social media, in particular, has created new avenues for comparison and self-criticism. The proliferation of Fitspo culture, curated influencer profiles, and edited photos can distort reality, leading to a heightened preoccupation with one's appearance. People may feel the need to emulate the bodies and lifestyles of influencers, leading them to engage in unhealthy behaviors, including restrictive eating. For individuals struggling with low self-esteem or body dissatisfaction, social media can be a breeding ground for negative self-perception, which can contribute to the development of anorexia. Family dynamics and parenting styles. Family plays an essential role in shaping an individual's attitude toward food, body image, and self-worth. Family dynamics, whether marked by support, dysfunction, or high expectations, can influence the development of anorexia. In some cases, parents may unknowingly contribute to the disorder by placing excessive pressure on their children to excel academically, socially, or in sports. In other instances, families with a history of perfectionism or control issues may create an environment where children feel compelled to achieve unrealistic standards, including those related to appearance and weight. Conversely, a lack of emotional support or unresolved conflicts within the family can exacerbate feelings of isolation and inadequacy, which may manifest as restrictive eating behaviors. Families dealing with high levels of conflict, stress, or dysfunction may unintentionally neglect the emotional needs of their children, leaving them vulnerable to adopting maladaptive coping mechanisms like anorexia. Peer influence and cultural norms. Peers and societal expectations also play a critical role in the development of anorexia. Adolescents, in particular, are highly influenced by their peer group, and bullying, teasing, or exclusion based on body weight or appearance can have long-lasting effects on self-esteem. In environments where physical appearance is prioritized, such as schools, sports teams, or social circles, individuals may feel pressured to conform to certain beauty ideals to fit in or gain acceptance. This social pressure can be particularly damaging for individuals who are already predisposed to eating disorders, as it may reinforce their unhealthy behaviors. Cultural norms also influence how body image is perceived. In cultures that emphasize thinness as the ultimate ideal of beauty, individuals may internalize these standards, developing an unhealthy obsession with achieving the perfect body. In other cultures, however, different ideals of beauty may exist, and the pressure to conform to those standards can create unique challenges in how anorexia manifests and is perceived. Environmental factors, from media influences to family dynamics and societal pressures, play a significant role in the development and progression of anorexia. These factors can either create vulnerability or act as protective elements, depending on the individual's exposure and coping mechanisms. Addressing these influences is an important part of both preventing and treating anorexia, as environmental factors can greatly impact how individuals perceive themselves and their bodies, and ultimately, how they respond to the disorder. Chapter 5: The Sociocultural Context of Anorexia. Anorexia nervosa is not just an individual struggle. It is deeply intertwined with sociocultural factors that shape how people view themselves, their bodies, and their worth. The cultural context in which anorexia develops can influence both the onset of the disorder and its persistence. In societies where appearance and body size are heavily emphasized, the pressure to conform to certain beauty ideals can create an environment where eating disorders thrive. Anorexia does not exist in a vacuum. It is influenced by a complex web of cultural norms, gender roles, and societal expectations that contribute to the internalization of unhealthy standards of beauty and self-worth. Societal expectations and beauty standards. One of the most powerful sociocultural influences on anorexia is the societal obsession with thinness. In many cultures, particularly in Western societies, thinness is often equated with beauty, success, and self-discipline. The media plays a central role in perpetuating this ideal, showcasing models, actors, and celebrities who embody a narrow and unrealistic standard of beauty. This representation of beauty creates a pervasive cultural message that being thin is not only desirable, but also essential for social acceptance and personal worth. For those already struggling with self-esteem or body image issues, these societal pressures can act as powerful triggers for anorexia. The rise of social media has intensified these pressures, as platforms like Instagram, TikTok, and Facebook provide constant access to curated images of perfect bodies. The use of filters, body editing apps, and photoshopped images has made these unrealistic standards even more difficult to escape. Social media has transformed the way people view themselves, creating a space where individuals compare themselves to an idealized version of reality. For many, this comparison can lead to feelings of inadequacy and a desire to shrink their bodies in order to conform to these standards. This constant exposure to idealized images can normalize the unhealthy behaviors associated with anorexia, such as extreme dieting, excessive exercise, and weight obsession. Gender and anorexia. Although anorexia is often associated with women, it is important to recognize that men can also develop the disorder, albeit in different ways. Cultural norms surrounding masculinity often emphasize muscularity and low body fat as the ideal. While women may be pressured to be thin, men may feel a similar drive to attain a lean yet muscular physique. This growing awareness of anorexia in men is critical, as the disorder is often overlooked or misdiagnosed in males due to stereotypes about who is supposed to develop eating disorders. These gendered expectations can shape how individuals approach their bodies and the lengths they are willing to go to in order to meet societal standards. Cultural norms also vary in different parts of the world, shaping how anorexia is perceived and experienced. In some cultures, the emphasis on thinness is less pronounced, and a fuller figure may be more desirable. However, Globalization and the spread of Western ideals through media and advertising are influencing body standards in a way that is contributing to the rise of eating disorders in cultures where they were previously less common. In these contexts, anorexia may take on different forms, but the core issues of body dissatisfaction, control, and societal pressure remain the same. The sociocultural context of anorexia highlights the ways in which societal expectations, media portrayals, and cultural norms shape how individuals perceive their bodies and their worth. By examining these influences, we gain a deeper understanding of how anorexia is not simply an individual problem, but a reflection of broader societal issues. Addressing the cultural factors that perpetuate unrealistic beauty standards and harmful body ideals is an essential part of both preventing and treating anorexia. Chapter 6: The Impact of Anorexia on Physical Health. Anorexia nervosa is a devastating disorder that profoundly affects both the mind and the body. While the psychological components of the disorder often take center stage in discussions about anorexia, its physical consequences are just as significant and, at times, life-threatening. As the body undergoes extreme weight loss and malnutrition, it begins to shut down essential functions in an attempt to conserve energy. The toll anorexia takes on physical health can be wide-ranging, affecting virtually every organ system, and can result in long-term complications that may persist even after recovery. One of the most immediate physical effects of anorexia is severe malnutrition. When an individual drastically reduces their caloric intake or eliminates entire food groups, the body is deprived of the essential nutrients it needs to function properly. As a result, the body begins to break down its own muscle tissue for energy, leading to significant weight loss, muscle wasting, and weakness. Malnutrition also affects the body's ability to repair itself, making it more susceptible to infections, injuries, and illnesses. In severe cases, malnutrition can cause organ failure, and the body may enter a state of starvation, which can be fatal if left untreated. The cardiovascular system is one of the most vulnerable areas impacted by anorexia. Severe weight loss and malnutrition can lead to a decrease in blood pressure, heart rate, and overall heart function. In extreme cases, this can result in bradycardia, abnormally slow heart rate, arrhythmias, irregular heartbeats, and even heart failure. The body's attempts to preserve energy may also cause a reduction in the size and efficiency of the heart muscle. Electrolyte imbalances caused by inadequate nutrition and purging behaviors, such as vomiting or excessive use of laxatives, can exacerbate these heart problems, leading to potentially fatal cardiac complications. Anorexia also has a significant impact on bone health. Prolonged malnutrition leads to a decrease in bone density, making bones fragile and more prone to fractures. The hormonal imbalances caused by anorexia, particularly a reduction in estrogen levels in women, further contribute to bone loss. Osteoporosis, a condition characterized by weakened bones, is a common long-term consequence of anorexia and can result in chronic pain, fractures, and a greater risk of disability as individuals age. Gastrointestinal issues are also prevalent in individuals with anorexia. Chronic starvation and purging behaviors can disrupt the digestive system, leading to constipation, bloating, and other gastrointestinal discomforts. In some cases, the body's digestive processes slow down significantly due to lack of nutrition, causing nausea, stomach pain, and a loss of appetite, which further perpetuate the cycle of malnutrition. The endocrine system is severely affected as well, leading to hormonal imbalances that can cause disruptions in menstruation, amenorrhea, fertility problems, and other metabolic disorders. The reduced production of thyroid hormones can result in hypothyroidism, leading to symptoms like fatigue, cold intolerance, and slow metabolism. In addition, anorexia can impair the body's ability to regulate blood sugar levels, increasing the risk of hypoglycemia, low blood sugar, which can cause dizziness, confusion, and fainting. The physical impact of anorexia is often insidious, slowly deteriorating the body over time. While the psychological aspects of the disorder may drive the behaviors associated with anorexia, it is important to recognize the profound and potentially irreversible consequences on physical health. These effects highlight the need for comprehensive treatment that addresses not only the psychological factors, but also the physical damage caused by anorexia. Early intervention is crucial to prevent long-term complications and to improve the chances of recovery. Chapter 7: The Emotional and Psychological Toll. Anorexia nervosa is not only a physical disorder, but also a deeply emotional and psychological one, inflicting significant damage on an individual's mental well-being. The emotional and psychological toll of anorexia is profound, often leading to long-term issues with self-esteem, identity, and emotional regulation. The disorder is characterized by intense internal struggles that affect the way individuals perceive themselves, their worth, and their ability to cope with emotions. These psychological challenges not only drive the behaviors associated with anorexia, but also hinder recovery, making it essential to address these issues alongside the physical aspects of the disorder. One of the most prominent emotional impacts of anorexia is the development of a distorted body image. Individuals with anorexia often perceive themselves as overweight despite being dangerously underweight. This distorted self-perception is deeply ingrained and is not easily altered. The preoccupation with body size and weight becomes all-consuming, overshadowing other aspects of life and contributing to an ongoing sense of dissatisfaction. The inability to see their true physical appearance can cause individuals to push themselves to extreme lengths to control their bodies, reinforcing unhealthy behaviors such as restrictive eating, excessive exercise, and purging. This distorted body image is closely tied to feelings of inadequacy and self-loathing, where an individual's value is determined by their ability to conform to perceived standards of beauty. The psychological toll of anorexia also manifests in the form of anxiety and depression. The fear of gaining weight, of losing control, or of being judged by others can create a constant state of unease. Individuals may experience overwhelming anxiety about food, eating, and weight gain, leading to obsessive thoughts and behaviors. This anxiety often extends beyond eating and body image, affecting other areas of life, including social interactions and daily functioning. Additionally, feelings of hopelessness, sadness, and depression are common, as individuals may struggle with a sense of emptiness or lack of purpose, often feeling disconnected from others. The isolation that results from anorexia, both socially and emotionally, can exacerbate these feelings of depression, creating a vicious cycle. Low self-esteem and perfectionism also play significant roles in the psychological toll of anorexia. Many individuals with anorexia have an intense need for control and may set unrealistic standards for themselves in an attempt to feel a sense of accomplishment and validation. This drive for perfection can permeate every aspect of their lives, from academic or professional success to personal relationships, often leaving them feeling as though nothing is ever good enough. These high expectations lead to constant self-criticism, reinforcing negative thought patterns that are difficult to overcome. The fear of failure, rejection, or imperfection can lead to further emotional distress, which is often alleviated temporarily through behaviors that reinforce the anorexic cycle. The emotional and psychological toll of anorexia is extensive, affecting not only an individual's mental health, but also their overall quality of life. It creates a complex web of distorted perceptions, negative self-judgment, and emotional turmoil that can persist long after the physical effects of the disorder begin to resolve. For recovery to be successful, it is crucial to address these psychological components, helping individuals to rebuild their self-worth, develop healthier coping mechanisms, and ultimately learn to accept and care for themselves without the need for control over their bodies. Chapter 8: Diagnosis and Treatment Approaches. The diagnosis and treatment of anorexia nervosa require a comprehensive, multidisciplinary approach due to the complex interplay of psychological, physical, and emotional factors involved. Early identification of the disorder is crucial to prevent long-term health complications and to improve the chances of successful recovery. While the process of diagnosing anorexia can be challenging, it is essential to recognize the symptoms, which often go unnoticed or are misinterpreted due to the nature of the disorder. Treatment, on the other hand, involves addressing not only the physical health consequences, but also the psychological and emotional aspects of anorexia, which are integral to recovery. Diagnosing anorexia nervosa involves a thorough assessment by a medical professional, typically a doctor, psychologist, or psychiatrist. The diagnostic criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, include restrictive eating patterns, an intense fear of weight gain, and a distorted body image. However, the challenge in diagnosing anorexia lies in the reluctance of individuals to seek help, as many are in denial about the severity of their condition or may hide their symptoms. As a result, healthcare providers must be vigilant in recognizing subtle signs, such as extreme preoccupation with food, body weight, and appearance, along with significant weight loss, malnutrition, or physical health complications. In some cases, patients may also present with comorbid conditions like depression, anxiety, or obsessive-compulsive behaviors, which further complicate the diagnosis and treatment process. Treatment for anorexia is typically a combination of medical, psychological, and nutritional interventions tailored to meet the specific needs of the individual. Medical treatment often begins with stabilizing the patient's physical health, particularly if malnutrition or medical complications have occurred. This may involve refeeding protocols, monitoring vital signs, and addressing any immediate health concerns, such as electrolyte imbalances or heart issues. Medical professionals play a critical role in managing the risks associated with severe malnutrition and ensuring that the individual's physical health improves as part of the recovery process. Psychotherapy is a cornerstone of anorexia treatment as it addresses the underlying psychological factors contributing to the disorder. Cognitive behavioral therapy, CBT, is one of the most widely used approaches as it helps individuals identify and challenge distorted thoughts and behaviors related to food, weight, and body image. CBT also helps individuals develop healthier coping strategies and emotional regulation skills. Family-based therapy, FBT, has also shown effectiveness, particularly for adolescents, as it involves family members in the recovery process, emphasizing the importance of support and communication in fostering long-term change. Nutritional counseling is an essential component of treatment, as individuals with anorexia often have little understanding of healthy eating patterns or nutrition. Working with a registered dietitian, individuals can develop a balanced eating plan that focuses on gradual weight restoration and healthy eating behaviors. Nutritional counseling also helps combat the fear of food and the myths associated with eating, promoting a healthier relationship with food. In some cases, medication may be prescribed to address co-occurring mental health conditions such as anxiety, depression, or obsessive-compulsive tendencies. Antidepressants or anti-anxiety medications may be used in conjunction with psychotherapy to support emotional well-being and improve overall recovery outcomes. However, medication is typically seen as a supplementary treatment, as it does not address the core issues of anorexia. The treatment of anorexia is a long-term process that requires patience, understanding, and a multifaceted approach. For individuals to achieve lasting recovery, treatment must address the disorder from multiple angles: physical, psychological, and emotional. The involvement of a support system, including family, friends, and healthcare providers, is vital in ensuring that individuals feel supported throughout their journey toward recovery. Ultimately, the goal of treatment is to help individuals regain control over their lives, develop a healthier relationship with their bodies, and build a foundation for long-term emotional and physical well-being. Chapter 9: Recovery and Long-Term Outcomes. Recovery from anorexia nervosa is a challenging, ongoing process that requires a combination of medical, psychological, and emotional support. The journey to recovery is often nonlinear, with periods of progress followed by setbacks. However, with early intervention, a strong support network, and a comprehensive treatment plan, individuals can achieve significant improvement and even full recovery. Long-term outcomes for those with anorexia vary, with some individuals experiencing lasting recovery and others facing chronic struggles with the disorder. The key to lasting recovery lies in addressing not only the physical aspects of anorexia, but also the emotional and psychological factors that contribute to its development. One of the most important factors in recovery is achieving and maintaining a healthy weight. This process may take time, as individuals with anorexia often have a deep fear of gaining weight, which can lead to resistance to treatment. Gradual weight restoration is typically emphasized to reduce the physical risks associated with rapid weight gain. Medical supervision is essential during this phase to ensure that the body can tolerate the changes and to monitor for any health complications. Refeeding protocols may be implemented to manage the risks of refeeding syndrome, which can occur when malnourished individuals are reintroduced to nutrition too quickly. Stabilizing physical health is a crucial first step in recovery, as it provides a foundation for addressing the underlying psychological and emotional components of the disorder. Psychologically, recovery from anorexia involves challenging and reworking deeply ingrained beliefs about food, weight, and self-worth. Cognitive behavioral therapy, CBT, remains a cornerstone of treatment during recovery, as it helps individuals identify and challenge the distorted thoughts that contribute to their eating behaviors. Overcoming the obsessive need for control and addressing the fear of weight gain are critical components of this process. Individuals may also need to work on building self-esteem and developing healthier coping mechanisms for managing emotions. Building a positive relationship with food and the body is a gradual process that often requires extensive support and encouragement. One of the challenges in recovery is the risk of relapse. Individuals recovering from anorexia may experience periods of distress, triggers, or stressful life events that cause them to revert to old behaviors. Long-term support, including ongoing therapy, support groups, and family involvement, is essential in helping individuals maintain their progress. Having a strong emotional support system and a clear relapse prevention plan can significantly reduce the likelihood of relapse. Long-term outcomes for individuals with anorexia vary. Research suggests that approximately 50 to 70% of individuals who receive treatment for anorexia achieve significant recovery, with many maintaining a healthy weight and improved mental health. However, a significant proportion of individuals may experience chronic difficulties with body image, self-esteem, and eating behaviors, even if they maintain a normal weight. In some cases, anorexia can become a lifelong struggle, with individuals facing ongoing challenges in managing their relationship with food and their bodies. Despite these challenges, many individuals with anorexia can lead fulfilling lives with appropriate treatment and support. Recovery from anorexia does not always mean a return to a perfect or idealized state of health. Instead, it involves learning to live with the disorder's complexities and finding ways to cope with its psychological and emotional toll. Successful recovery is characterized by improved physical health, a more balanced relationship with food and the body, and the ability to manage life's challenges without resorting to disordered eating behaviors. For some, recovery may also involve redefining personal identity and developing a sense of self-worth that is not dependent on appearance or weight. Ultimately, the path to recovery is unique for each individual, and while challenges persist, the possibility of a fulfilling and healthy life is very much within reach for those who seek help and remain committed to the healing process. Chapter 10: a call for greater awareness and support. Anorexia nervosa is a serious and complex disorder that demands greater awareness and understanding from society. Despite its prevalence and devastating impact, eating disorders like anorexia are often shrouded in stigma and misconceptions. This lack of awareness can prevent individuals from seeking the help they need and can further perpetuate the cycle of suffering. To create a supportive environment for those struggling with anorexia, it is essential to promote better education, reduce stigma, and provide accessible resources for prevention, treatment, and recovery. This chapter highlights the urgent need for increased awareness, compassionate support, and systemic changes to help those affected by anorexia and similar disorders. One of the biggest barriers to seeking help for anorexia is the stigma that surrounds eating disorders. Society often misconstrues anorexia as a simple issue of vanity or self-control, failing to recognize the complex psychological and emotional factors at play. This misunderstanding can lead to victim blaming, where individuals are seen as weak-willed or shallow, rather than as individuals struggling with a serious mental health disorder. Stigma can also prevent people from discussing their issues openly, making it harder for them to seek help or support. By challenging these misconceptions and fostering a more empathetic, informed perspective, we can create an environment where individuals feel safe seeking help and acknowledging their struggles without fear of judgment. Increased education and awareness are crucial steps in addressing the stigma surrounding anorexia and other eating disorders. Public health campaigns, school programs, and social media efforts can all play a role in disseminating accurate information about the signs, symptoms, and risks of anorexia. These initiatives should focus not only on raising awareness, but also on promoting positive body image and self-esteem, helping individuals recognize the dangers of societal pressure to conform to unrealistic beauty standards. By educating the public about the seriousness of anorexia and its psychological roots, we can shift the narrative from judgment to compassion and support. It is also important to provide more comprehensive and accessible treatment options for individuals with anorexia. Many people who struggle with eating disorders face barriers to receiving the care they need, including financial obstacles, long wait times, and a lack of specialized treatment centers. Expanding access to care, particularly in underserved areas, is vital to ensuring that those affected by anorexia receive timely and effective treatment. Additionally, insurance coverage for eating disorder treatment should be improved to make care more affordable and accessible to a wider population. Support for individuals with anorexia should extend beyond the clinical setting. Families, friends, and communities play an essential role in the recovery process. Support groups for both individuals with anorexia and their loved ones provide a safe space for sharing experiences and offering mutual support. Training for family members in how to provide compassionate, non-judgmental support can also enhance recovery outcomes. The importance of a strong support network cannot be overstated, as it provides emotional stability and encouragement throughout the recovery journey. Finally, prevention efforts must be a key component of any strategy to combat anorexia. Early intervention, education on healthy eating behaviors, and promoting body positivity are essential tools in preventing the onset of eating disorders. By teaching young people about the dangers of extreme dieting and the value of self-acceptance, we can foster a generation less likely to fall victim to the pressures that contribute to anorexia and other eating disorders. In conclusion, a greater awareness of anorexia and more robust support systems are essential for tackling this widespread and destructive disorder. By addressing the stigma, improving education, expanding treatment options, and providing ongoing support for individuals and their families, we can help reduce the prevalence of anorexia and support those who are already struggling. It is time for society to recognize anorexia as a serious, treatable condition and to provide the resources and understanding necessary for individuals to heal and thrive. Conclusion: anorexia nervosa is a multifaceted disorder that impacts individuals on a physical, psychological, and emotional level. Throughout this exploration, we have gained insight into the complex nature of anorexia, from its biological and psychological foundations to the environmental and sociocultural influences that contribute to its development. The emotional and psychological toll that anorexia takes on individuals is profound, often leading to lasting consequences that extend beyond the disorder's physical symptoms. However, recovery is possible, though it is a challenging and ongoing process that requires comprehensive care, including medical, psychological, and nutritional interventions. The path to recovery from anorexia is rarely linear, often involving setbacks, relapses, and periods of significant emotional and physical strain. However, with early intervention, the right support systems, and a holistic treatment approach, many individuals can experience long-term recovery. Addressing anorexia involves not only restoring physical health, but also helping individuals to rebuild their self-esteem, challenge distorted body image, and develop healthier emotional coping mechanisms. For recovery to be successful, it is essential that the psychological and emotional aspects of the disorder are tackled alongside the physical symptoms. While recovery is achievable, it is clear that the journey is unique for each individual. Success does not always mean returning to a perfect state of health, but rather involves learning to manage the complexities of the disorder, rebuild a healthy relationship with food and the body, and foster a strong sense of self-worth. The role of support, whether from healthcare providers, family, friends, or peer groups, cannot be overstated in this process. It is through empathy, understanding, and sustained care that individuals struggling with anorexia can find the strength to overcome the disorder. As we reflect on the societal aspects of anorexia, it becomes evident that greater awareness and support are urgently needed. Reducing the stigma surrounding eating disorders, promoting body positivity, and expanding access to treatment are all crucial steps toward ensuring that individuals with anorexia receive the care they deserve. Education about the complexities of anorexia, alongside efforts to improve mental health resources and reduce the barriers to treatment, will help create a more supportive environment for those struggling with the disorder. In conclusion, anorexia is a disorder that demands more than just medical attention. It requires compassion, understanding, and a commitment to addressing the underlying emotional and psychological struggles that contribute to its development. By fostering greater awareness, offering support at every stage of recovery, and creating a more informed society, we can help those affected by anorexia to reclaim their lives and well-being.